Hello, today I will be informing you on anorexia nervosa. The case I did was on a 10-year-old who was suffering from the disease. With anorexia, there can be purging or binging, eating. With anorexia, you restrict your diet and you fast and excessive exercise. There is also bulimia nervosa, which is binging and purging to avoid weight gain. Typically, eating disorders come about during adolescence for females and males, but it's more prevalent for females. About 1 in every 200 girls will develop an eating disorder. Anorexia psychological factors. Patients seem to be more introverted and they seem to be more compulsive in their attitude. They also have an avoidant lifestyle. They have a starvation as a punishment to show control. Next, anorexics tend to have a perfectionist attitude. Basically, they have higher than average grades. Everything else in their lives seems to be perfect, I guess. Anorexics tend to be worriers as well. Most anorexics are proud of the weight they lose, and due to that, that makes the situation worse, basically, because they keep striving to go lower and lower in their weight. There is also a high correlation between depression and anorexia. Basically, if you have one or the other, you have a higher risk of having anorexia. Eating disorders can also run in your family. There are some risk factors as well. Family factors play an important role when you develop anorexia. Some examples of this include if you were sexually abused as a child, you have a higher risk of basically getting an eating disorder when you're older. Also, children with other psychiatric disorders are at a high risk as well. A common risk factor is anxiety, like I said before. Next, I will be talking about the specific case involving Lisa. Lisa was a 10-year-old who was of mixed Caucasian and Native American background, and she was suffering from anorexia nervosa. Lisa was in 4th grade when her teacher had concerns about her health. Her teacher started noticing drops in her weight along with her mood change. She started out as a slightly overweight and happy girl and just became skinnier and skinnier over a 10-week period and lost 20 to 30 pounds. The mother was pleased to see her losing weight and saw no concern of her health. This concerned the teacher because she saw a big change in her attitude at school as well. Something normal that Lisa was going through was that she had a perfectionist attitude with her work. That's something normal in regards to in general, but if you have an eating disorder, that's a trigger. Also, she was at a normal weight. Before she had her eating disorder, she was a little overweight, basically, and that was normal for a 4th grade. You're allowed to be a little overweight. She was basically in the normal range until she started feeling like she was fat. An abnormal aspect was that her mom thought nothing was wrong, and that's a big thing because parents are supposed to be really paying attention to what their children are going through, and her mom thought nothing else of the weight loss or how fast it happened. She basically thought that was a good thing because she thought her kid was a little overweight, but the way she lost the weight was very unhealthy. Something also abnormal was that Lisa became antisocial. There were some things that Lisa was going through that made her more prone to having a eating disorder. One of those things was she was a girl. Girls are more common to have eating disorders and are at a greater risk. Lisa was also white, which prevalently white women generally tend to have the disease. And she was also of a social economic status, which was kind of normal, but she also had a father that wasn't in her life, which also could be a direct factor that could affect her having this disease. The diagnosis of this case was she was very young to have anorexia nervosa, So that was also something that made this very critical to kind of get treatment right away. Anorexia can be deadly, and your organs can shut down if not treated correctly. There can also be possible differences in the brain of those with anorexia. Basically, that involves the neurotransmitters. Anxiety and depression are linked with anorexia, and it's common to have all three, so she could also be going through that as well, even though she is so young. The diagnosis comes about when you have a psychological exam. Now let me talk about what anorexia directly is from the DSM-5. To have anorexia nervosa, you basically have to restrict what you're eating, which results in a low body weight, basically. That is unhealthy, basically withering away. There's also an intense fear for gaining weight. Basically, if you have anorexia, the gaining a pound is a big issue. Weighing yourself every day and seeing that pound difference, whether it's just from water weight or something, it's a big intense fear that they have. There's also a disturbance in the way one sees their body, basically. So they have a distorted version of the way they see themselves. They look in the mirror and we see skin and bones, basically. She could be a size 0 and she sees herself as being like a size 20, basically. Lastly, I will talk about the assessment of this case and eating disorders in general. There can be a good outcome if treatment is done early. There can also be therapy done with a therapist, and also you can use antidepressants. Anorexia can become life-threatening if not treated. Therapy is a big part of the treatment of anorexia. Next, anorexia can run in families and is a common pattern in home life of those who have anorexia. The common pattern of home life basically is that it's a demanding mother with a passive father. The main way of assessment is a psychological exam. In conclusion, my personal insight is I have a strong feelings and know much about this due to the fact that I had an eating disorder in my younger teenage years. I can relate and have gone through the treatment process. I think the whole idea that women have to be skinny and to feel pretty needs to stop.